Hey there, my name is Amr Kuchak, and I'm a cornea, cataract, and refractive specialist. Like many doctors, I wanted to pursue my passion for impacting lives in a positive way. But the journey wasn't always easy. Medical school was long and difficult. Trust me, I ate plenty of late-night tuna salad sandwiches, but thankfully, it was also during this time that I met my mentor who inspired me to go further than I thought possible in my career. My mentor is an ophthalmologist, specifically a cornea and cataract and refractive surgeon. He was truly loved by all of his patients, residents, and teammates, and on one occasion, I even witnessed him perform surgery on a patient with count fingers vision, and then watched that same patient return the next day with near-perfect 20/20 eyesight. It was this moment, witnessing the genuine joy of someone whose quality of life had exponentially improved, that inspired me to become an ophthalmologist and do the same for others. The surgeon is instrumental in performing the work that improves a patient's life, but they are never alone in the journey to helping patients see better. Everyone on the clinical staff, from the receptionist to the technician and surgery counselor, plays a role in supporting a patient's healthcare. My goal today is to share some important knowledge behind why we do certain things, particularly when it comes to diagnosing and treating dry eye disease, to continue making a positive impact in patients' lives. In this lesson, we'll cover a brief review of dry eye disease, including its prevalence. We will also discuss the importance of diagnosing and treating dry eye. And lastly, I will review in more detail how cyclosporin works, and more specifically, discuss the clinical information for CEQUA. Dry eye disease is one of the most prevalent conditions out there, affecting patients of all ages. Having more knowledge about this condition will definitely help you in your day-to-day. So let's get started. First of all, what is dry eye disease? Dry eye disease occurs when the eye's tears are unable to lubricate the eye properly. There are many factors that contribute to this problem occurring, namely hormonal changes, most often found in women, inflammatory and autoimmune disease, as well as certain medications a patient may be taking, such as antihistamines. These conditions can cause insufficient tear production, poor quality of tears, and tear evaporation. In simple terms, tear insufficiency triggers an inflammatory response from the eye. During this inflammatory response, T cells, along with other inflammatory mediators, become activated. The T cells then secrete cytokines that, once secreted into the tears, inflame the ocular surface. But this cascade of events disrupts the natural process of nerve stimuli in the eye, resulting in the disruption of tear production by the lacrimal glands. It's a vicious cycle, like a bad social media post gone viral. Once the inflammatory response kicks in, it keeps sharing the bad vibes until the eye is extremely inflamed. When you carefully take a history of your patient, please pay close attention to their complaints about feeling uncomfortable, having scratchy, burning, or even watery eyes, feeling discomfort when wearing contacts, when staring at screens for extended periods of time, or any other symptoms of dry eye disease. The doctor will need all of these details of their symptoms, the severity, duration, and reasons why this problem may be manifesting in the first place. A complete history is important to help your doctor make a diagnosis quickly. Using a speed questionnaire is a great tool to quickly gather the information your doctor will need. A quick pro tip during this diagnosis phase: my preference is to use the fluorescein strips over the fluorescein drops with the patient's eye. I prefer this because drops can flood the cornea and you would miss the dryness that you would otherwise see if you just used the strip. Depending on what is specifically causing the dry eye disease, your doctor will target treatment to address the root cause. In many cases, he or she will incorporate high-quality omega-3s to improve the quality of tears, as well as address the inflammatory component. Additionally, many doctors will also prescribe hot compresses and treatments such as LipiFlow to support oil secretion from the meibomian glands. Pharmacological options are almost always part of the dry eye disease treatment regimen. Most common is the use of cyclosporin-derived eye drops, such as CEQUA. CEQUA received FDA approval in 2018 and is indicated to increase tear production in patients with keratoconjunctivitis sicca, aka dry eye. Now, what makes CEQUA unique is how it delivers cyclosporin. Allow me a moment to nerd out. Essentially, CEQUA is able to penetrate through the ocular tissue to reach the site where it's needed. It does this by using nanomicelles, advanced proprietary N-cell technology, which is made from a polymer blend that self-assembles and works together to protect the cyclosporin before it is delivered. Think of the nanomicelles like a tiny water repellent suit of armor. It protects the cyclosporin and penetrates the aqueous layer of the tear film. Once the armor penetrates, the cyclosporin is delivered to the ocular surface and the armor breaks up, letting the cyclosporin spread through the ocular tissue, aka the eye. Besides the super cool science, what is important to understand is that a medication cannot perform its proper function if it is not delivered to the right tissue. CEQUA helps ensure that the active molecule lands on the desired target to decrease inflammation and improve tear production. With this targeted transport system, absorption of cyclosporin is higher than if it was simply working alone. While technological innovation is great, what we clinicians truly care about is how effective a drug is in helping patients who are suffering from dry eye disease. CEQUA has been evaluated for safety and efficacy in treating dry eye disease, and in a recent study showed clinically meaningful improvements in treatment over a placebo effect. CEQUA appeared to rapidly improve ocular surface signs of dry eye disease and demonstrated a numerically greater treatment effect in conjunctival staining, corneal staining, visual acuity, and tear breakup time compared with the placebo after 14 days. The results showed that 16.6% of patients using CEQUA had an increase of 10 millimeters or greater from the baseline, meaning there was 10 additional millimeters of surface benefit to the eye, while only 9.2% of those using the placebo experienced the same increase. In addition, many people taking CEQUA experienced improvement in visual acuity after just 56 days. Every millimeter is valuable when you consider the relative size of our eyes. Let's just say the ocular real estate market is highly prized. While we like to focus on benefits, it's important to also note any potential side effects patients may experience. For patients taking CEQUA, most adverse events were mild or moderate. The most common adverse events reported were installation site pain in 22% and conjunctival hyperemia in 6% of patients. Other adverse reactions reported in 1 to 5% of patients were blepharitis, eye irritation, headache, and urinary tract infection. So that's it for your dry eye disease primer. I hope you have a better understanding of this common disease and how you can assist in diagnosis and treatment. On a personal note, I really do believe that Sun Ophthalmics has done a tremendous job in bringing CEQUA to the market and making it accessible for patients. I very often have to fight with pharmacies who want to dispense a generic medication instead of CEQUA. But as we covered, there is a significant difference in the effectiveness of delivery provided by their little armored cyclosporin. And now that you know about it, it might be an opportunity for you to educate others on the difference between a generic and CEQUA, because for me, there really is no comparison. Thank you for watching, and thank you for having a positive impact on your patients' lives.